Welcome to our seminar today. It's an exciting seminar on an important subject. I'm Steve Goldsmith. I'm a professor of urban policy at the Harvard Kennedy School and your moderator for today about an important project that we've been working on for the last several months. Before we begin, the Ash Center would like to acknowledge the land on which Harvard sits as a traditional territory of the Massachusetts people and a place which has long served as a site of meeting and exchange among nations. The format today is we'll have a report on our project and then a mayoral panel with Mayor Cantrell and Mayor Baraka. And we'll begin with a short survey and summary of the reports of our work. Let me just say, this seminar today, I think, is quite important. Mayors have taken a leadership role, obviously, in a number of things, but including the response to COVID. And this project, this data, this information helps us understand the drivers of resident behavior on vaccines, including the social determinants of health, allows us to look at how cities can minimize negative impact of misinformation and how mayors can use their voice when they understand how their communities react to their voice by ethnicity or by neighborhood, certainly by social information as well. So with us today are several of our important guests. Sarah Grazeboard, who's the president of Bennett Midland, Isle Feder-Levy, who is the CEO and co-founder of Zen City, who did the technical work. But first, we'd like to begin with George Hobor. George is a senior program officer at Robert Wood Johnson's Foundation. They funded the work. And George, over to you.
Thank you, Steve. It's nice to be here today. I'm George Hobor. I'm a senior program officer at the Robert Wood Johnson Foundation. For those who do not know the foundation, we're the nation's largest philanthropy focused specifically on health. And I'm very excited about today's presentation. The foundation supported this project as a part of its Transforming Public Health Data Systems initiative. And this is a new initiative that people will hear more about in this year and into the future. It developed in response to the data challenges we saw with surveilling and responding to COVID-19. So the lack of disaggregated data, the failure to have complete data on institutionalized populations, such as incarcerated individuals, gaps in data that could be used to explain variation in cases and death rates by community, the lack of timely data that could help us identify developing hotspots before people were actually in hospitals. All of these concerns and so much more motivated our response and folded into this initiative. To start the initiative, the foundation awarded 20 grants to explore different dimensions of the data challenges we were seeing. And I championed this grant because I felt we weren't doing enough to explore the role of data in strategic communications. I also saw a gap in our support for public-private partnerships. And to me, this project represented a very interesting way to use data and analytics to conduct community engagement rapidly, almost continuously, and at scale. To me, it presented a compelling method for political leaders to get a read on the community and to craft responses that could resonate broadly and therefore most effectively spur behavior change for positive health outcomes. So knowing the challenges of getting complete community participation in engagement activities and responding in a manner that is perceived as authentic, or at least in a manner that is not assailed or dismissed, I thought this project was worth supporting, and my colleagues at the foundation agreed. I do think it's always funny to see how our perceptions of a project end up playing out, and you always end up learning so much more from the project on the ground. So, but for sure, this is an important one for us. We'll be using the information from it, as well as information from the other 19 grants to reimagine how public health data, broadly defined, are collected, shared, and used, and identifying what public and private sector investments are needed to strengthen public health data systems with the express purpose of reducing inequities in health. I know some on the call on this webinar might want to know about the other grants as well, and we don't have anything externally facing on them at the moment. I can say they cover very varied terrain, from exploring the potential of electronic health records for public health purposes to navigating the legal limitations on reporting health data by race to finding ways to use environmental data from NASA and other sources to better measure environmental hazards and their impact on health. But I think this is much more than a communications project. That's what it was kind of slotted in as in this initiative, but I'm certainly eager to see how it's unfolded. I'm happy to answer questions about the other grants, the initiative I mentioned, or the foundation's work more broadly. Participants here should feel free to find me on the foundation's website and reach out. But right now I'm eager to learn more about this work. And with that, I hand it over to Sarah.
Thanks so much, George. We'll be really quick, and we really appreciate the support of the Robert Wood Johnson Foundation. So just to set this up, this event marks the completion of a vaccine hesitancy study in 18 cities and counties across the country, including Newark, New Jersey, and New Orleans, Louisiana, at really a critical moment when vaccines are becoming widely available and government officials are squarely focused on increasing vaccination rates. Our partners at Zen City, whom you'll hear from in a second, led an analysis of organic discourse on social media platforms and surveyed residents to understand the drivers of positive and negative sentiment around the vaccine. And simultaneously, we sort of seized this opportunity to capture some insights from practitioners about the value of sentiment analysis in advancing public health strategies, and in particular, strategies that include some public messaging and communications. And in that work, we surfaced many examples from the mayors who are joining us today, Mayor Baraka's Facebook Live events, which he'll likely tell you about, and the Shot for Shot initiative in New Orleans, which launched after Mayor Cantrell encouraged the hospitality industry to participate in vaccination efforts. Importantly, to some of the points that George just raised, we learned that sentiment analysis can really add a very rich new layer to municipal data systems and enable cities to rapidly test the effectiveness of their own messaging strategies on resident opinions and attitudes, and also identify and potentially minimize the impact of misinformation. So we're really delighted to be joined by Mayors Cantrell and Baraka today. You'll hear from them momentarily, but first I'd like to introduce Eyal Federlevy, who is the co-founder and CEO of Zen City, and he'll present some of the highlights from this study.
Thank you so much, Sarah. It's a pleasure to be here today to be speaking about this super important topic, and especially as the previous speaker has mentioned, how data can actually make an impact on it. And what I want to share with you for just the next few minutes are some of the key findings of our insights across the 18 communities in which we ran this study, insights that can be applied and can be used by local communities across the country. So I'll share my screen and we will review some of the main takeaways, main actionable takeaways from the study that are relevant across all of the local communities. And the full report will be made available to everybody who registered for this webinar, and you'll receive a link to get access to the full report later today or tomorrow. So just a word on methodology. As Sarah mentioned, how did we collect data? Here across these 18 communities, we applied a mix of two methods. One was look at what we call organic input, meaning things that people share in their local communities on online channels like Facebook, Twitter, local news websites. And we also ran online representative community surveys in each one of these communities, creating a representative sample of each and every one of these communities, totaling almost 9,000 survey replies from all of these communities. And the analysis included breaking down that data into 6 different dimensions. First, the level of interest that people were showing in the vaccine. Second, their sentiment towards it and towards COVID. Third, their interest in their intention in actually getting vaccinated, their actual experience of getting vaccinated, recognizing specific subgroups, which we'll get into in a second, within the community. And last but not least, the role of local leadership, cities and counties in changing the discourse about vaccines. And I'd like to share with you just a quick sample of some of our takeaways, but I strongly encourage all of you to read the full report as well, as it has some an incredible wealth of information from my perspective. The first thing I want to share with you is that overall we saw more positive than negative sentiment towards the vaccines, but not overwhelmingly, meaning 22% of all of the organic conversations were positive, but 14% of them were negative. The rest were informational, or what we call neutral, neither positive nor negative. Some of the main drivers of the positive sentiment included messages that were directly linked to the local community, how the community was doing, expanding eligibility and availability, the capacity to return to everyday experience, the reopening that would follow the vaccinations, and hearing personal experience with getting the vaccine. Negative drivers of sentiment, including lack of confidence in the vaccine efficacy, the underestimation of the risks of COVID-19, and lack of information on how to technically register to get the vaccination. And last but not least, issues of equity, unequal distribution of vaccination facilities across racial lines or borders between rural and urban locations. The first takeaway I want to share with you beyond those drivers of positive and negative are our ability to recognize who are the meaningful groups to target the message to. And in this case, if we follow President Biden's guidance to reach a 70% vaccination rate, we can see that across the 18 communities, about 30% of the people we surveyed were at the moment not intending to get the vaccine, but are still open to influence to get the vaccine. And we recognize that group as a group the messaging should be targeted at. And we were able to also recognize who are some of the main demographic groups that make up that group. One of the most interesting takeaways, actionable takeaways that we found is that the more the local city or county was active in sharing information with their community, the more positive the local discourse was about the vaccination. And here I want to share just a quick example from Oklahoma City, where we can see that the rate of discourse in Oklahoma City coming from official channels, meaning channels owned by the city, was much higher than our cohort average. And as you can see, the positive sentiment towards the vaccine was also much higher in that community. So in the full report, we have recommendations on what language specifically to use, and even some examples of posts, for example, this one from the Oklahoma City mayor on how to drive vaccine adoption by being proactive and sharing messages with your community. Another interesting takeaway is what would persuade people to get the vaccine if they're hesitant. And interestingly enough, the two of the main drivers that we saw actually had to do with practicality and not some higher essence. One was the convenience of actually getting the vaccine, meaning the availability of vaccination sites, the ability to get to them, the ability to schedule an appointment. And the second was the fact that the vaccine would be required for activities like going back to local businesses or going back to the gym. These two things were the two strongest drivers in persuading people that were skeptic in getting the vaccine, which we found very, very interesting. And the last takeaway I want to share with you, very simply, is that equity is a very, very big part and a very, very important topic of focus that we want to share in the takeaways from the vaccine. As we can see here, when we look at the white Caucasian community, we can see that the people that intend to get vaccinated are lower than the percentage of people that are already got vaccinated. But in other communities, especially in the Hispanic Latino community, in the African American community, we can see that much more people would like to get vaccinated than the people that have already had. And that is, from what our study found, oftentimes because of lack of access to vaccination sites and other capabilities. So thinking about the distribution of equity of vaccinations is a key part of what local communities should be working on to get more of their entire community on board and vaccinated. So those are just a few examples of our takeaways that could be applied to each local community. And I strongly encourage all of you to read the full report. Each of the cities also got a personalized report for the takeaways for them, and hoping that this will help serve local leaders and local communities in the vaccination effort. And with that, I want to turn it over to the panel.
Thank you very much, Ayel. And we have two of the country's most outstanding mayors joining us today for this panel. We're going to have about a 15-minute conversation with them. Occasionally we'll ask Ayel for kind of a technical answer, but we want to go to the mayors. And then after their comments and presentations, I'm going to ask them a few questions, and then we'll go to the panel. Then we'll go to the audience, and feel free to chat up your questions as well. I mean, what we're dealing with here today is a particular interest, right? It's how a local government official who's respected can use his or her voice to affect the behaviors of their residents, right? And encouraging them to utilize the available vaccines, especially when the mayor is competing against a fair amount of misinformation on social media and conflicting national and state voices. These two mayors have been particularly outstanding in using their voice and setting up programs and policies and activities in their communities. So let's go first to Mayor Cantrell and then to Mayor Baraka, just how you think about the vaccine rollout, not just the mechanics, but how you think about the communication strategy in order to improve the take-up rates of vaccines. Mayor Cantrell, please.
Well, good morning, and thank you for having me. And it's always good to be alongside my brother, Mayor Roz. For some reason, my camera is saying that I'm not admitted, so I'm just going to roll with it. As you all have indicated, as it relates to the hesitancy and the need to trust public officials is definitely necessary. In New Orleans, they call me Titi. So I'm looked at as the auntie, of the city, and of course the mother of the city. But that comes, it's an affection, that they have, and it is respect. But I'm going to say, right now we have about 50.3% of our eligible population fully vaccinated, pushing to get to that 75% herd immunity. We have been very intentional going to our Black and brown areas where we know we need, to focus, that were the hardest hit. We have had to, and I know it was mentioned, shot for shots for our hospitality industry. We have vaccinated all of our home bound residents as well. We have created, sleeves up NOLA using our cultural bearers and artisans to encourage residents. We have tapped into our influencers as well, and the influencers on social media are very important, and you have to, one, have their respect and trust in order for them to even push the message. But we have just seen tremendous responses to going into the community, working with our musicians as well to get our folks vaccinated. We've also been able to use Zen City to survey our folks and to determine what and who they trust the most. And so what we found is that they also want to hear, from folks who look like them, the people that who are in their families, other aunt and uncles and Mardi Gras Indians even that they believe in. And so we have just engaged with them on the ground. We've also worked with our barbers and beauticians, again, who are trusted figures in the community, educated our pastors, faith leaders, and it's a different approach than offering a gift card for folks to roll up their sleeve. But we just keep engaging our residents to show them the value of getting vaccinated. And of course, being the mayor and being out there and being very public on display, getting vaccinated myself. My daughter, will be getting her vaccination on tomorrow, and she wants to be an example as well. But we just find that this is our way of building that trust, and they need to see you also walking the talk. And it's proven to be very effective.
Thanks for your presentation. We'd like to see you too. I think that Melissa in the Harvard shop's trying to send some messages to you, Mayor. Maybe we can get this fixed. Why?
Okay, now they have me. Thank you.
Now, well, sometime we hope to see you and hear from you at the same time. We'll be back to you shortly. You've been doing a lot of work. I've got a number of follow-up questions. Thank you very much. Mayor Baraka, same question, and how are you responding, please?
How you doing, Mayor? How's everything? Good. It's a pleasure to be on here. Always a pleasure to see my friend there, and just echoing some of the same sentiments that were already expressed. We obviously on our live Facebook Live, we have 3 days a week. Probably for the last year. We've had every Wednesday doctors of color, nurses on talking to people, specifically addressing all of the the misinformation, the other issues that they may have, the hesitancy, just and basically general questions. We've been doing pop-up sites around the city that doesn't require registration. You could just walk up and get vaccinated. In the beginning, the state and the county and all these folks set up these huge sites, expecting that people would be coming to those sites. But if you're hesitant, you're not going to catch a bus, register, and wait in line for something that you're hesitant about. So we had to make it available to them. We also went to people's homes who were homebound, who could not get out of their homes, seniors and other folks. We vaccinated them, and we're vaccinating our residents without addresses. So we've done a number of things, using, again, like we said, local influencers. But I think the greatest asset that we've had, which was said, I got vaccinated. We try to vaccinate as many people as we can in a community who people would respect. And I would say the more people get vaccinated, the more people get vaccinated, right? So, and that's basically been what we've seen. So going to the neighborhood and vaccinating people helps us vaccinate more people. And that's better than any advertisement, money that's being spent on anything else. We bring people out, try to vaccinate people on the block, and prayerfully everybody else will get themselves vaccinated as well in that vein. So we've just been talking to the people regularly. And the last thing I want to say, we've never forced people. We never forced the vaccine on people. We never lectured to folks. We never told them that they ought to do this for the good of the community, for this or that. I basically told them that they should, get the information that they need, research, study what this is, listen to what's going on. And when you're ready, take the vaccine. And getting people who other folks trust to do it first. And then other folks began to take it from there.
Thanks, Mayor. I've got a couple questions for you, and then back to Mayor Cantrell. Io, can you bring up, without taking the mayors off the camera, can you bring up the slide you've got that shows trusted messengers? I think both mayors are trusted messengers, but Mayor Baraka just mentioned how he activated, for example, Black doctors and others who are trusted in communities. While that comes up, Mayor Baraka, we saw some pretty positive responses to your Facebook conversations. Could you just tell the audience about those a little bit, please?
The Facebook conversations, we've been bringing doctors on every Wednesday, for the most part, most Wednesdays, doctors who are from pediatricians to epidemiologists, whoever we could get to talk to the community specifically about issues that they have. And information that they've heard, and they've addressed that very matter-of-factly and in layman's terms, without a lot of doctor talk. So it was very simple, and people responded to that. In fact, I know a young lady who said she got the vaccine, registered for the vaccine the next day after she heard one of the doctors begin to speak about it, and specifically around how it affects women of color and maternity and all of those other specific things. So it's been working.
Thanks. I was just, I'm going to go to Mayor Cantrell, but Mayor, I was noticing the importance of nonprofit messengers. Religious leaders are more important in some communities than others.
Yes.
I know you both have kind of reached out culturally. Let me, Mayor Cantrell, I have two questions. One about this, and then Niall can take it down. The second is, so I was doing a little research for the seminar, and I found out that in Washington, D.C., there are groups giving away free weed if you get inoculated, but in New Orleans, you get crawfish, which seemed like a slightly better approach to the incentive process. So maybe you tell us a little bit about local messengers, and if you want to plug New Orleans crawfish at the same time, you can do that.
Well, it is crawfish season, and we love some good food in the city of New Orleans, and that was an easy way to get people connected to what they love. But really, it's the locations that matter as well. So trusted areas in the community. So it's not just the crawfish, but it's the crawfish on top of a safe space that is known to invest in people. And so it's like a win-win all around. And so utilizing our nonprofit community, which covering from Hurricane Katrina. So having those lessons learned and making sure that we kept those relationships viable with our nonprofit community have just paid dividends as we've moved through this pandemic. And so even, utilizing our cultural bearers, when I talked about Sleeves Up NOLA, that really started with, we started with Mask Up NOLA campaign, where we had our cultural community, our musicians, your high profile public figures saying mask up, which was very effective. We were able to beat that virus back, and we just picked up that same method to getting people vaccinated. And so even with the shots for shots, and we're a hospitality driven community. We have festivals. This is in the middle of festival seasons. We have second lines. And so I've had to kind of threaten a little bit now, Brother Mayor, because our folks, want to get back to celebrating, our traditions and loving on one another as they're used to. And the only way to do that is through the vaccine. So I've had to say, look, you want second lines to come on back, but we can't get there. You want Jazz Fest to come back. You want Essence to come back, so I've had to, and even as I gear up for Essence Festival this year, which is going to be virtual, but we will have some activations in the city in June. But I am saying that you have to be vaccinated to participate. So those are just other ways that we're leveraging our nonprofit community, our partners, for festivals to get people vaccinated, and it's working, and people are eating crawfish at the same time.
Io, would you bring up, just as the mayor just said, you have a slide on what are the persuasive factors for getting people vaccinated. And I want to come back to this incentive, culturally sensitive incentives that the mayor mentioned. Mayor Baraka, I noticed that one of the few voices more effective than yours in Newark was Queen Latifah. You want to tell us about that?
Well, of course, Queen Latifah is an icon in this community. So obviously, she came with her family and got vaccinated. Didn't make a big hoopla out of it. She's shooting a movie here. She said while she's here, she wants to get vaccinated. We made that happen, and we broadcasted it obviously across the city. And it encouraged other people who look at her as a regular person, not just like as a movie star, but somebody that they can relate to, who obviously is successful. And when she got vaccinated, it helped other people do the same.
I'd like to ask the mayors to look at something on this chart, and then I'm going to ask each of you about it. This is set up by Mayor Cantrell a minute ago. But if we say vaccine, Io, why don't you just give us 30 seconds about what is meant by vaccine is required for activities? When I read that, I was thinking about the way LA Dodgers got special seating for the vaccinated. And then when I asked the two mayors, because it sounds like, so far, it sounds like Mayor Cantrell is a little more willing to twist the arms of folks in her community, maybe than Mayor Baraka. I exaggerate just to create a little conversation here, but tell us what that means. And then let's take that down and hear from the two mayors about how they think about required activities as incentives for vaccine.
Yeah, it's definitely that, Steve. I think what we see is that more and more activities require having that document that you've been vaccinated, and more are to come. So the Dodgers example is great, but some businesses let vaccinated people in, and so on and so forth. So this understanding that you will have to show your vaccination, for example, to travel to specific places or enjoy certain services or businesses, was definitely one of the main considerations here.
Mayors, could you talk just a little bit about how you're thinking about, right, we have incentives and we have levers, right, and how you think about both, right? So we have your voice, which is the information from Zen City has found that both of your voices are particularly effective, particularly when combined with ease of accessibility, pop-up vaccinations, like Mayor Baraka said. But how about the incentives or levers that are shown as particularly affected as well in that last chart? Mayor Cantrell, and then back to Mayor Baraka.
Well, I think that, well, for the city of New Orleans and how we just, again, experience one another through cultural events and festivals and the Saints season, the schedule was released on yesterday. And right before this call, I got a call, from the dome and asking me my thoughts about filling the dome. And I said, listen, if you need to push vaccinations, you need to push it. We need to get to herd immunity. We can do this definitely before September, no doubt about it. There is no reason why anyone should not be vaccinated, meaning the accessibility is there. We have more supply than demand now. And so I am saying, if you want to be in that dome, in September, then it is contingent upon being vaccinated. And that is something that the organization seems to be embracing as well. But even, as it relates to Essence Festival, as I just mentioned, and that is, a Black-owned media company. It's the largest festival in the United States, and particularly where African Americans emerge, on the city of New Orleans. And when I think about my community, Black and Brown hit the hardest in this city, and out of 792 deaths, 600 reflect, Black people. And so I'm like, hey, and you're coming back to our city in which we love the partnership. But if you are upholding the Black community and Black folk, I need you to get with me on this and push this community to be vaccinated. And so they've embraced that concept as well. And so anyone who would participate in our small activations will have to have had their first dose or, definitely completed the vaccination process. I stand by it simply because the greatest impact in this community have been Black and Brown through deaths and closely aligned with our cultural community.
Mayor Baraka?
Yep, I would have to echo everything that Mayor Cantrell said. That's right on the money in terms of who's been affected and the death rate here in New Jersey. And I would imagine that is the same all over the country. I think that urging folks to get vaccinated to participate in these things is the right thing to do. Obviously, at the Prudential Arena, at New Jersey Performing Arts Center, all of these things, people are beginning to advocate for either showing a negative test or a vaccination in order to enter these events. And I think that is obviously the way to go. Your data shows it. This is something that people have been talking about. And I think that's something that we should be doing in New Jersey.
Do you know? I'm not sure. This might be somebody working for the two of you, but we have a number of audience questions about how one would implement vaccine verification. Do you know how they're doing it at the Prudential Center? If they give incentives, they asking for a cell phone picture, or just assuming people are telling the truth, or what?
Well, I think it's both. I think that they're asking people for their vaccination cards, because I went to an event, they had that. They're asking people for proof that you have, the letter from the doctor or whatever, that's saying that you have a negative test. But there is also a database that people are talking about, this passport. New York is, piloting it as well, where you already in the state's database. So if there's an app that they can go into and see your name in the database that you have in fact been vaccinated, it's not a difficult thing to do to be able to create this app where people can see that you've been vaccinated because you're in the state's database.
Mayor Cantrell?
No, I would agree. One, the state Department of Health has this app they've created where you can download your card, your vaccination card, and have it readily available. Of course, you can have your card physically. I'm encouraging people to get it laminated, and you show your card and or a negative test as well. But I am leaning more towards the the vaccination card and encouraging people to sign up on the Louisiana Department of Health's website in order to have it just readily accessible at any given time they would need it.
I've got one more question for the mayors, then we'll go to audience questions. Isle, when I looked at your research, there were differences by ethnicity in certain trust of certain things, right there. And when I saw, though, however, I think I got this right, in Philadelphia, it seemed to me, where the mayor used kind of census taker door to door to do the reach out, the black-white trust levels were the same, right? So when there was a neighborhood tailored program to reach out. So I just want you to give us a little bit of the facts about the differences in trust level by ethnicity. And I'm going to ask the two mayors how they think about kind of their message and their outreach, kind of overcoming some of that distrust.
Well, in terms of outreach, we have been, I get my data sets weekly as it relates to the census tracts on where people are vaccinated or where we need to focus. And so we go straight to that census tract. We created neighborhood navigators where we employ neighborhood leaders who live in those particular census tracts. We've equipped them with laptops, and the technology needed where they're able to help our people navigate, whether initially it was the getting tested, but now it's transitioned into getting vaccinated as well as getting employment opportunities or unemployment insurance or whatever they feel that they need. But the meet people where they are concept is something that we have embraced 100%. And it is through these navigators that we're now scaling up that will be a part of our recovery. So it's getting us to herd immunity, but also getting people back to work, getting their kids back to school, and providing them with the tools that they need. And in some cases, some hand holding that's necessary, that will be necessary through case management, for example, to get us to a full recovery. So that initiative we built right from the start, but just scaling it up now as we're moving towards a full recovery. And I think that people, neighborhood leaders are the world's greatest experts on where they live and the people who live in their neighborhood. And so we just feel, again, they're a trust factor. They're going door to door. Hey, we know this household needs to be vaccinated, and we'll go with you even. So we feel that those are concepts that will build trust and get people vaccinated, and that will improve the public health outcomes in our city.
Great, very helpful. Mary, have anything you want to add?
Not really. I think she said exactly what needs to be said. We have a group called People's Assembly. They meet regularly. They go out and talk to the local organizations, the community groups, the district leaders, the block association folks, and really empower them to help us get the people in those areas that we know are lacking to get vaccinated. And the only way they're going to do it is if we bring the vaccinations to them. They're not going to come out of that neighborhood to go get vaccinated.
So I'll, just before we go to the audience questions, Sarah, I'm going to ask you to kind of referee or curate the questions. Two things. I'm interested in what you saw as the biggest differences by ethnicity or by age group, so that we can, because this is a conversation, right, about the persuadables or whatever the word is you used in the survey, right? It's not about, the hardcore conspiracists are not going to believe Mayor Baraka probably, or Mayor Cantrell, or even Harvard University, surprisingly enough, right? But there is a group of individuals that are persuadable by the message we talked about. So just a word or two about the differences by age and ethnicity, and then let's go to the questions.
Yeah, definitely. And I think that point you made now is one of our most important takeaways, is that the persuadable group can get us to that 70-75% vaccination rate, and there's no need to fight the diehard anti-vaxxers, right? We should focus our energy on the people that are open to a conversation and are willing to to have that conversation and have, the right messaging, the right efforts in order to get there. And one of the main findings that we shared before is exactly to Mayor Baraka's point right now, is that that those door-to-door initiatives, those pop-up initiatives, they mean a lot because many of our communities just don't have the same rate of access to vaccinations as other communities. We see here again by ethnicity that in the white Caucasian across, again, 18 cities and counties across the country, there is a higher rate of people that already got vaccinated than the ones that intend to get vaccinated. But in communities of color, in the Black and brown communities, we can see that the people that want to get vaccinated, intend to get vaccinated, are much higher than the ones that actually got vaccinated. And that is, again, if we go back to the other findings, oftentimes because of lack of convenient access to vaccinations. So that equity of distribution, those initiatives of going to door to door and such is meaningful. And what you shared, Steve, on differences by ethnicity, I think are also interesting. When we look at what is actually driving vaccine hesitancy, what are the things in each of these communities that drives skepticism towards the vaccines, we see that varies quite differently between communities. There's, for example, a very different rate of trust in the personal, the fear of the personal risk in different communities. Very different levels of thought about concerns about the effectiveness of the vaccine in different communities between the white community and Black community, and so on. So definitely we need to tailor the messages to the different communities to the people that we want to make an impact on their decision making.
Great. Sarah, let's think a little bit. What's your most interest? I'm trying to read your notes to me and talk at the same time, and I'm not one of those news anchors, right, who can do that very easily. So what's the most interesting question you have? I'd like to kind of continue though, if we just, let me take Aisle's last question, turn it back to the two mayors while you kind of go through the questions. So Mayor Baraka, then Mayor Cantrell. So if we're thinking about, we have this range of things that you all can do, right? We have encouraging local sports teams to offer incentives, using your voices, pop-ups and the like. And we have this very interesting statistic that the number of folks of color who are interested in getting vaccinated actually exceeds those who are vaccinated, right? So what are the other practical things that you can think about in your communities? Because we have a lot of people listening today that could benefit from how you're thinking about addressing those communities, persuadable communities, mostly of color, interested in being vaccinated, but need just a little bit maybe of a nudge or a convenience factor. What else could we do?
I mean, recently we had an event in Ivy Hill Park, which is an area of the city where we had low vaccination rate. We gave out food. We had a DJ out there. We gave out information. We created the kind of, and we told people we were coming, and we created the kind of atmosphere where people came out. We vaccinated 141 people that day. Just walk-ups. Nobody registered. Probably half of them did not even know that we were going to be out there. They came out there and got vaccinated that day. Over 70 of them were vaccinated with Johnson & Johnson, who they took it still, and in that community. So it's evident that if you go to the neighborhoods, if you have something there, an event, people where you capture them and they stay and they participate, they will get vaccinated. When they see other people get vaccinated, especially outside, when they seeing people get vaccinated, they'll stop and want to be a part of that as well, which is what we're going to continue to do in the city, block by block, in areas where we're having difficulty.
Yeah.
Cantrell, your answer, and also have you utilized neighborhood churches at all to do outreach?
Oh, absolutely. The faith-based community has been front and center throughout, the past 15 months. First on, trying to stop the spread and getting tested and the like. And now that's just pivoted towards vaccinations. And so we have seen that that is very much effective. Like my brother Mayor said, I don't think it's rocket science. It's just something that we have to do, be consistent and continue our efforts, reaching people, meeting them where they are. And the more people that get vaccinated, the more people get vaccinated. I agree with that 100%. It's evident just in the data. Whether we just did something similar to, it's these events, just, like my brother Mayor just said, on Mother's Day, we had mothers, and mimosas, we had mothers out there, they were getting vaccinated. And even in spite of, the setback with J&J, which was really a setback, but in spite of that, people are still trusting it, which is a good thing. And we're encouraging that. But that allows, some people just want the one shot. And that's been proven to be effective as well. They just want the one. And now that it's back online, we're seeing, again, by rates of 70%, people taking J&J. So we're going to be consistent, stay out there as long as it takes.
You obviously have a huge, hope to again have a huge hospitality business, tourism business in New Orleans. And that would mean that hospitality workers who are disproportionately folks of color, right, would be exposed potentially, right? So are there outreach programs for those workers as well?
Oh, absolutely. That was my primary target as well from the very start, and making sure that our people who are the backbone of the industry were a priority. And that's something that we pushed for earlier on when we began to receive the vaccine doses. And so we elevated them as a priority class, which sent that message that they mattered. And they are on the front lines as well. And so we have just seen a significant not only outreach, but also those who have gotten vaccinated. But I also use it as an opportunity to hold the businesses accountable. They want to open on back up and, this 100%. But I'm like, hey, you have to care about the people who are on the line that are, allowing you the opportunity to make a dollar. And so, while on the front end, they would say, oh, the industry is the biggest economic driver. Yeah, over 96,000 people are tied to our industry, right? Okay, well, now the vaccines are here. Well, how many of that 98,000 can you tell me have been vaccinated and through efforts that you have spearheaded? So I kind of turn that map around a little bit and push the accountability on them, because, hey, they need to demonstrate that they care about the folks who are on the ground. And so that has proven to be effective as well. And so once people believe that you recognize that they matter, then I think that helps not only them get vaccinated, but also bring forth their families to do the same thing. But we have to dignify people throughout this pandemic, and of course, throughout recovery. The days of making people feel like, hey, you can use them, I think are over. We have to show the love and dignify them through our response as well.
That was a terrific answer. I'm so glad you're going to be on. We're going to YouTube this, so a lot of people will see that's a great answer. I have one follow-up question for you, Mayor, and then we'll go to Mayor Baraka, and we're almost out of time. But Mayor Cantrell, just a quick follow-up question. It looks like from the Zen City data that young adults are more incented by tying the vaccine to an activity that they can do, right? They can, whether it's a game or a bar or an event. How have you thought about, we've spent a fair amount of time here, as we should, on the equity messages. How about that demographic, that 18 to 30-year-old demographic that has been a little bit more, I don't know, tone deaf may be unfair, but a little more resistant to the vaccine? How do you think about reaching them?
Well, one is, like you mentioned, they love to be, a part of events and festivals. I mean, that is what we have going for us right now. We're in the middle of festival season, kind of gearing up. People want Jazz Fest back. They want They want buku fast, that, you know, they want all of these different voodoo fast, all the things that they have participated in every single year. They want to be able, you know, to engage. And I'm saying, hey, you need to be vaccinated in order for me to make the decision to provide, you know, permits for these large events to happen. So, and of course, just a second line, you know, which is a big deal, you know, in our city, and for our Mardi Gras Indians to mask and, you know, to show off their new suits that they've been sewing all year long. You know, this is something that our people are ready to get back to. And I'm saying, if you want to do that, you're going to have to do this first. And I think it's working. We're just, again, trying to be as consistent as possible. But more young people getting vaccinated will only get more people vaccinated.
Let me close with a couple questions, starting with Mayor Baraka and then ending with Mayor Cantrell. Mayor, this project started with RWJ funding to think about how we would use data to help understand the efficacy of the mayoral message, right? If the mayor, as we know, local officials are the most trusted political officials in the country, government officials in the country. So we were interested in looking at your message, right? And using the data to figure, and we have, what is it, Iowa? We have 10 cities in your study. How many cities, in addition to these two, are
18 overall.
18 cities. And that data is available on the website, either Harvard or your website?
Yeah, we will share a link to download the report either today or tomorrow.
So it was about using the data to reach out. So Mayor Baraka and then Mayor Cantrell, as we go forward, based on what you've seen about the data, what you've seen about the results of your message, community engagement and the like, how are you going to think about the next month or two in terms of your effort to convince the folks that are persuadable about vaccines?
Well, I honestly, I just think that we're just going to ramp up what we've already been doing. We're just going to ramp it up, invest more time and energy in that. Also involve the state in making sure we get enough access to the vaccines to understand that we're going to double our efforts. So we need double the amount of vaccines and get them to help us concentrate in these communities that are under-vaccinated. As the state talks about the huge vaccination rate that the state is going through without thinking about our community, we have to encourage them to send us more vaccines and even more people to help us get into these communities and get that stuff done. It should be all hands on deck. And that's basically what we're going to do. These pop-ups and events is what we're focusing on. We've already done the churches. We've already done and one thing about the churches, a lot of people in some of those churches, they don't live directly in the community. You go to churches, hit and miss. So we have to go to people's housing complexes. We have to go to their neighborhoods, through the block associations, to be able to get these things done. And we're just going to ratchet that up.
Well, congratulations on what you've accomplished. Mayor Cantrell, closing comments on go forward strategies based on what you've done and what you've learned, please.
Yeah, well, continuing to do what we have seen works. And that is, you know, meeting people where they are, going to them, educating them, spending whatever time that's necessary to get them comfortable with taking the vaccine, you know, the case management piece, not just about the vaccine, but also other areas within their lives, you know, where they're having some challenges, where you can also focus on those aspects as well, because it demonstrates that that whole person matters, you know, to you, and they're a part of the community, and it's dignifying them in the response. And I think that we're going to continue to do that. Also, as our higher ed communities are preparing for students to return to campuses, they will be requiring students to be vaccinated. I'm going to leverage that message with my parents who kids attend public school, that I know they want their kids to be in school. I do too. We recognize the trauma and the impact on our young people being disrupted all last year and through this school year, that we cannot afford to repeat that. And so we're still in the midst of this pandemic right now. It's not over, but the way that we can get on to recovery is through the vaccination. So we'll just double down, as my brother mayor indicated, and continue with strategies that have proven to be effective and pivot where we need to and be open to that. And I'm, on the ground and talking and on these campuses, and I'll be driving around and walking around and on the microphone and just doing what it takes.
Maybe you can get the mayor to loan you Queen Latifah for a second or two. You can.
Here
you know enough
again,
folks
we
down
step
there.
back from learning.
Let me just say that I think based on the research, and thanks again to George and Robert Wood Johnson Foundation, we came away encouraged that there is an opportunity here to convince enough folks to get to herd immunity numbers, and that they can be convinced with a range of tools, accessibility tools, family and friends saying the right thing, respected local leaders, being ethnically sensitive about who folks are listening to and what their interests are. So the work in both of these cities stands out. I would encourage you to look at the report for the rest of the cities as well. George, we're going to continue to advocate for the use of data for innovation in solutions. You've been, Robert Wood Johnson, talking about social determinants of health for a long time, and we think this is a factor that shows we can be more equitable in how we respond to these things. George, you want to say anything? Nope, you're off. You missed your chance. Nope, now you're back on.
Oh, I disappeared for a second. No, I don't have much to say. This was a great panel, and just thanks to everyone involved.
Io, congratulations on the survey. Sarah, thanks for taking the lead in the project. The results will be emailed to everybody who's signed up and will be posted. Sarah, how soon on either the Harvard or Zen City or Bennett Midland sites?
I think it will be posted on the Zen City site. Let's just say tomorrow for sure. So.
Okay, Sarah's just guaranteed within the next few hours it'll be posted on the Zen City. Mayors, thank you very much for your leadership and your voice and your time, and we are adjourned. Thank you.
Thank you. Thank you. Good seeing you.